Good evening. My name's Heather Johnston. Tonight I'd like to disrupt the way we think about international development and the role that non-governmental organizations can play in creating social impact. I've had a rich and rewarding 20-year career working in international aid. I've had the privilege to live and work throughout Africa. I spent over a decade in Mali in West Africa, and I've also spent time in 5 or 6 other African countries. What troubles me most, despite having spent so much time working in this sector, is the paradigm of foreign aid from high-income countries like Canada and the role that NGOs play in how that aid gets distributed. I recently had an experience that really challenged this paradigm, and tonight I'm hoping I can challenge you to think a little differently about how we might do things. I want to start by saying there are many international NGOs that do transformative work around the world, and I like to think I work for one of them. My aim is certainly not to discredit this work. However, in Africa and across much of the global south, we see a major power imbalance between high-income countries that give aid and the low-income countries that receive that aid. Foreign aid is very often dispersed by international NGOs, and they directly deliver programs in the areas of health, education, agriculture, and they deliver these programs in partnership with local governments and community organizations. And I put that in quotes because it's been my experience that these programs are usually designed and implemented with actually very little collaboration or consultation with the people that they're meant to benefit. When there is consultation, more often than not, it's just lip service. The reality is that when you control the purse strings, you control the agenda. And that can lead to some very bad decisions and some very bad development. A couple of examples. In Africa, I regularly saw bureaucrats from donor countries make decisions with very little understanding of the historical, political, cultural context in which they operate. Sometimes these bureaucrats are controlling budgets larger than the Minister of Education or the Ministry of Health in those countries. I've seen NGOs set up parallel health systems, clinics, hospitals. They set these clinics up with international aid funding, and then they poach the top bureaucrats away from the public health system. Again and again, I have seen projects that are driven by donor interests and their funding priorities. And these are all examples that are in direct contradiction to the principles of sustainable and community-driven development that can lead to social impact. In 2015, I joined Dignitas International here in Toronto. We're a medical and research organization that works to strengthen healthcare systems. And we have programs in Canada and in Africa. After a decade of strengthening the AIDS response in rural and remote communities in Malawi, Dignitas wanted to leverage its experience to help Indigenous communities here at home facing similar challenges. Challenges such as limited access to health infrastructure, to health professionals, and what we might call perhaps the lack of culturally safe care to meet patient needs. We know that Canada's colonial history has led to absolutely disastrous health outcomes for Indigenous people in this country. And yet, the Truth and Reconciliation Commission reaffirms the right of Indigenous people to determine their own health needs and have ownership of the health systems in their communities. So at Dignitas, we started on this journey with a feasibility study to assess if an NGO like Dignitas could play a meaningful role in supporting Indigenous communities in improving health outcomes. As a result of this study, we were invited by the Sioux Lookout First Nations Health Authority to explore community-based models to respond to an urgent diabetes epidemic in rural and remote communities in Northern Ontario. In forming the partnership with the Health Authority, we identified very early on some core tenets of that relationship, and those were learning and equity. We were quite deliberate in collaborating where our skills as an NGO were needed to close a gap and complement the work of our partner. And I'd like to think that this differs quite a bit from how NGOs traditionally might do this kind of geographic expansion, where it would be driven by funding availability. In our partnership, with the Sioux Lookout Health Authority, we did a few notable things that I like to think really shifted this balance of power and gave a greater voice to our partner and the people that they serve. The first thing we did is we consulted. We consulted with a diverse group of stakeholders, including patients, who helped to shape a community health worker program focused on strengthening an Indigenous-led model of diabetes care. We also challenged the conventional model of north to south knowledge flow, and we did that by visiting community health worker projects in the Global South in places like Pakistan, Brazil, Zambia. We took what we learned from those programs and we brought them back to Northern Ontario. Finally, we worked collaboratively to design the pilot community health worker program. The Health Authority, they took the lead on implementing this program, while our NGO role was focused on training, research, evaluation, where our skills were needed most. Good development that creates social impact requires authentic partnerships that are rooted in common objectives, in equity, and in trust. On paper, it sounds obvious. In practice, it's not easy. It means fostering an open dialogue and confronting differences that may be profound. For an international NGO that was used to driving its own agenda, it felt quite risky to take the back seat and to trust, to create a space that gave agency to a local partner and that valued their knowledge and their know-how. It takes humility and a willingness to open ourselves to learn and approach the work and the world from a different perspective. And I have to say, we certainly did not always get this right. But we have an opportunity to redefine the NGO role, and we learn this from this partnership. There's an opportunity to shift this balance of power back where it belongs, in the hands of the people we support to build better communities and better lives for themselves and their families.